Today I want to talk to you about chronic pain.
Having to talk to somebody about pain can be really difficult at times if you think about it. Nowadays, with everybody cutting back on the use of opioids because of later addiction problems and things like that, and tighter regulations, doctors are now becoming very skeptical of people with chronic pain, especially if you present to the ER.
So when you go to the emergency room because you can't wait until the morning to go see your regular primary care physician, the doctors in the ER are already going to be suspicious of you. Well, how do you communicate what's going on, especially if you have a condition like I do, like Ehlers-Danlos, where there's no radiological evidence that's going to be found? They're not going to find a broken bone. They're not going to find, this huge degenerative issue, or maybe they will, but even still, it's not going to signal to them anything that is life-threatening. And the ER's job is to just basically get you through the short term. And they have a lot of people that come in there looking for drugs, unfortunately. And so because of those people, it makes it 10 times as hard, if not 100 times as hard, to get medication from the emergency room if you are in pain.
So, how do you show a doctor in a way that's not subjective, that is objective, meaning universal? How do I tell them if I can't prove that my Ehlers-Danlos is giving me issues?
How do I show them that pain is legitimate and that I need medication, or that even not just medication, that I'm in pain and I need something to help me just last me until I can get to my primary care physician who already knows what I'm going through?
Well, the best way is to, number one, be honest with yourself.
Not every day can be a 10. Now, there are some days that, I feel like I am a 9.5 and I can barely lift my head up out of bed. But that's not every day.
If you're going into the emergency room and you're talking on your phone and playing games and laughing and eating and
joking and things like that, and then you tell the triage nurse that you're like a 10, they're going to wait until you leave.
And then they're going to say, drug seeker, because obviously you're not a 10.
Beyond being honest with yourself, what are some of the objective ways you can describe pain? Be very, very specific. Instead of saying something like, I'm hurting really, really bad, that doesn't mean very much. It doesn't give the doctor very many details. It doesn't tell you where the pain is located. It doesn't tell them how long you've been having the pain. It doesn't tell me anything about the type of pain, which could potentially help the doctor figure out what's going on with you.
So let's start with location. Where exactly is your pain located? Is your knee hurting? Okay, well, which one? Is it your right or your left knee? Is it the front or the back of your knee? Is it the side of it? Is it one side more than the other? Is it your left shoulder? Is it your right shoulder? Is it your eye, your ankle? And exactly which side? Is it the front or the back? Those types of locations and specific details will help your doctor be able to assess what they can do for you.
In addition to helping your provider understand how to help you, this will also give you credibility. You're coming in there with a specific complaint. Even if you have pain all throughout your body, that's okay. Explain each and every location exactly and tell them, my left shoulder in the front is hurting. My right ankle on the side over here is hurting. Even if you have to list each and every single body part because you are hurting from head to toe, go ahead and do that. That will help you.
It's going to help you, give you credibility. It's going to help your doctor figure out what's wrong with you, what the best test would be to do. Maybe there's something that you don't know that maybe they can order a test and actually help figure out what's going on with you.
The pain scale is so ridiculous because, like I said, it's very, very subjective. My 4 or 5 might be somebody else's 10, or it could be maybe even their 2. I don't know. And I'm pretty much a 4 or 5 every single day.
So rather than giving them a pain number, you can say words that describe your pain. You can use words like throbbing, aching, nagging, gnawing,
stabbing, shooting, feels like an ice pick, knife, burning sensation, heat.
So if your end goal is to help get some kind of something that can help you in the short term,
don't just say it hurts a lot, or use descriptive terms. Say, my right ankle in the front has been killing me all night. It feels like somebody is taking a knife and just stabbing it in there and using it like a joystick. That type of description is going to give your doctor a very clear understanding of what exactly is going on. You're not just coming in there saying it's very bad. You're painting a picture for them.
It's going to help them because they're going to be able to say, okay, well, if it's hurting her on the front side, maybe it's this. Or if it's hurting on the inside, maybe she did this. Or things like that.
So the next time you head to the ER, here's a few things to remember. Use specific details about the location and the duration of your pain. Use descriptive words to help paint a picture of what your pain feels like to you.